Um, Hello everyone, how are you? Today we are going to know the community and school health personnel. So when we say the school health personnel, we're going to know who are the different personnels or health related personnels that are present in our school. And we will also know the different agencies or different types of the health personnels. What are their main or what are their majors upon doing such health precautions. So today, just sit back and relax for me to um, give you some more information about the following health personnel. So are you ready, guys? I hope you're ready. So let's start. I am Teacher Sanli, your teacher for today. Hello. So when we say school health personnels, they are the common health personnels. We can see here the doctors, the nurses, and we call them mostly as the doctor and the nurses. But we don't know their major or their main surgeons that they are making. So, yung tawag lang talaga natin is yung common na doctor and nurse. Pero hindi pa natin alam kung ano ba talaga yung major nilang ginagawa. So, to understand more, just listen. When we say health personnels, your health appraisal is completed with the help of your doctor, nurse, dentist, and other medical professionals or practitioners. So, when we say health 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 appraisals, ito po ay isang grupo ng mga ating health or medical practitioners. So, we will know who are them. Who are they? So when we say health appraisals, they work at health facilities or places that provide medical care, like in the school clinic or your barangay health centers. They also work in the hospitals, centers, or kung saan merong kailangan na or kung saan merong tinukod na isang health facilities. So every time there is a presence of a health facilities, there should always be a health appraisals also. It could be a nurse, doctor, or yung mga dentist. So those are the examples. So here is kanina nasabi natin na health practitioners will be present in the school clinic and barangay health centers. So, bakit nga ba kailangan na meron doon sa may school clinic and barangay health centers? Number one, when we say school clinic, I hope you're familiar with our school clinic and so you're supposed to know where is the school clinic in our school since you're grade 6 already. So when we say school clinic, dito po yung health records of pupils are kept. Dito po lahat ng mga estudyante, the school nurse or the school like for us, the school nurse should have health records in our school clinic. Kasi dito, BMI is usually calculated. So when we say BMI, it's weight over the meter squared in height. So kailangan nating i-compute yung BMI. Dati, we have already computed our own BMI, but it should be the school nurse since online class tayo or we're on modified blended learning. So for today or for this year, we're going to compute the BMI. Pero next year, if we're going to be in normal na, babalik na tayo sa normal, so the school nurse will compute your BMI. Then students go there to see the school doctor, dentist, or nurse. Example, if you're having sakit sa ngipin, so you will go to the clinic. And if your tummy is aching, so you will proceed to the clinic because you will ask the school nurse or any medical practitioners that is in the school clinic para ma-assist kayo kung anong nangyari sa inyo. Then, we're going also to go there if the pupils do not feel well because of sudden headache, toothache, or fever while attending classes. So, sinabi nga kanina ni teacher, if you're feeling sick or you're having a toothache, what's it? Your tummy is aching, so you just need to proceed to the school nurse. But first, you need to ask the permission of the teacher. Then next is the other health tests such as vision, screening, dental examination, hearing test, blood pressure, scoliosis test, breast examination, and urine examinations are also needed to be practiced or to be examined in the school clinic. I know you already know the different tests because I had already discussed this. So in case you didn't remember, you can just search in our YouTube playlist. So that's for our school clinic. So if we are feeling sick inside the school premises, so we just need to go in our school clinic and ask the school nurse or school doctor what will be the best remedy for us to feel good or well. And next is the barangay or the rural health center. So when we say barangay health center, it is managed by a healthcare professionals or practitioners. So this is actually a barangay health center. Anyone na may hindi pa nakakakita or nakakapunta ng health center, so in case you didn't know still the barangay health center, you need to ask your mama, papa, tita or tito kung saan yung barangay health center. Para in case of emergency, you already know where to go. So, in barangay health center, you need to manage by a health professionals or practitioners. There should always be a nurse or a doctor inside the barangay health center. And it should also provide healthcare services to its constituents. Like for example, may nadisgrasya sa may highway. So, pag malayo pa or malapit kayo sa may barangay health center, you may just go to the barangay health center for you to have the first aid. Then, ita-transfer na kayo sa may hospital for the medication. Then, provide free medicine to residents. Some of the residents already know that there is always a free medicine in the barangay health center. In case na hindi nyo pa po alam, there is always a free medicine to residents. Example, paracetamol, biogesics. So those are free medicines that you could ask in the barangay health center. But before you ask, you need to have check up or also the some of the health specialists you could check on. One, we need to have the obstetrician. When we say obstetrician, it is they are the specialist in caring for the mother before, during, and immediately after birth. So, sila po yung nag-aalaga sa mama natin or sa magulang natin after or bago yung baby mapanganak, during napapanganak, or after the birth. Kasi 'di ba after the birth, they need to have vaccinations. So, the obstetrician um should be the medical practitioners that we should be asking for help after the mother give birth or before giving birth. Next, we need to know that gynecologist, again, it's the gynecologist. They are the specialists in women's condition and diseases, especially of the female reproductive system. So, kung halimbawa, your mother or your parents cannot bear a child or kung hindi sila nakakapagpanganak or hindi nagkakaroon na kayo ng kapatid, aside from you, nagkaroon na kayo ng problema, yung mami nyo, so you need to go to the gynecologist. You need to ask their help or you need to consult the gynecologist kung anong nangyari sa reproductive system ni mother or ni mommy. I hope it's clear. Again, obstetrician is the specialist we need to go if our mother give birth or after giving birth to our siblings or our younger brothers, sisters. But if your parents or your mama is experiencing some problems in our female reproductive system, so they need to go to the gynecologist. Yan lang po yung tip. Obstetrician pag nanganganak, gynecologist pag may problema sa reproductive system or yung sa part ng female. Then next, we need to know that pediatrician is a specialist in health and illness of children. So, pag sinabing pediatrician, ito yung para sa mga bata. Kung may mga sakit, or halimbawa sinisipon, tapos may lagnat, ubo, so you need to go to the pediatrician. Pag yung hint nito is pedia, so children. Then, ophthalmologist. Ophthalmologist is the specialist in treating eye conditions and diseases. So, ang tawag natin sa kanila ay the optometrist or ophthalmologist. Sila yung nag-check palagi ng ating mga eyes. If ever na hindi nyo na maklaro or you're feeling dizzy kung may tinitingnan kayong letters or words na malayo sa inyo, so you need to ask your parents to go to ophthalmologist and let them check your eyes. Baka kasi you need some eyeglasses for corrections or kailangan nyo lang ng medications. Next, we have also the neurologist. Pag sinabi nating neuro, it's brain. Neuro is nasa utak. So, they are the specialist in diagnosing and treating disorders of the 24 nervous system. So, pag sinabi nating nervous system, it's all about our brain. Pag sinabi nating neurologist, it's all about brain. Kaya, pag sinabi nating neurologist, sila yung specialist about sa brain natin. Again, neurologist is for our brain. They are the specialists for our brain. Next is the psychiatrist. They are the specialists in the treatment of mental and emotional condition and disorder. If we are feeling depressed, so we're feeling empty, worry, fear, anxiety, those different or negative feelings, we need to ask the psychiatrist kasi they are going to formulate kung ano yung mga naiisip nyo. And they are also going to discuss what are the do's and don'ts na kailangan yung isipin. So, in case na nafe-feel kayo na worry kayo masyado or anxiety kayo, depressed, so you need to proceed to the psychiatrist. Psychiatrist is all about emotions nyo or mental disorders. Next, we also have here the surgeon. It performs surgical-related cases. So, pag sinabi nating surgeon, sila yung mga mostly na nag-o-opera. Like, for example, yung mga artista, so, they let the surgeon do their nose. Pinapatangos pa nila yung ilong nila. So, they go to the surgeon kasi nagpapa-surgical sila or nagpapa-surgery. So, yung gumagawa ng surgery are the surgeons. Here is the gerontologist or the specialist for the aged and elderly. Pag matanda na po tayo, we call the doctors or the medical practitioners na gumagabay sa atin or tumutulong as the gerontologist. Again, for when we say gerontologist, ay ang mga doctors or medical practitioners para sa mga matatanda. Pag sinabi naman nating para sa mga bata, we call them as the pediatrician. Pag sinabi nating matatanda, are the gerontologist. And we have here the nephrologist, specialist to the disorder of the kidney. Meron po tayong 2 kidneys in our body. And pag may mga nararamdaman kayong masakit, kaya kailangan you need to drink at least 8 glasses of water every day. Kailangan, you need to minimize drinking soft drinks para hindi kayo magkaroon ng sakit sa kidney or magkasakit sa bato. Pero pag mayroon kayong mga sakit sa bato, kailangan nyo na pong pumunta ng nephrologist para magtanong kung ano pa yung magiging remedy or kailangan pa natin gawin para masalba natin yung kidney natin. So, you just go to the nephrologist. Lastly, we have here the podiatrist. When we say podiatrist, they are the specialist various feet-related diseases. Sila yung mga nag-check sa ating mga paa. Kung halimbawa binaha tapos naglakad tayo sa baha, so we need to go to a podiatrist para i-check kung may mga nakuha ba tayong mga kagaw or mga germs na galing sa baha. In case there is, so kailangan niyo pong pumunta ng podiatrist. I hope you guys take note of the different medical practitioners or yung mga nagpa-practice nito. For us to remember, I will have a review. So when we say medical practitioners, sila yung mga nagigive ng ating or they are the health related. So in Philippines, we called it as the Department of Health. So they are part of the Department of Health wherein they keep us healthy. Kasi kapag hindi natin nafe-feel na safe, so we just need to talk to them. Lalo na pag may mga nafe-feel tayong karamdaman. So, these are the specialists. We have here the obstetrician. If our mother is giving birth, before giving birth, and after giving birth, they need to talk to a obstetrician to um to the different reminders na sasabihin ni obstetrician. Then, kung may mga problema silang na-experience before, during, and after birth, so they need to talk to the obstetrician. Next is the gynecologist. Ito yung mga specialist na kailangan nating puntahan if ever hindi na po nakakapanganak si mommy. Then, pediatrician, ito yung mga specialist for the kids or for the children. Then ophthalmologists are the specialist para sa ating eyes. Kailangan po, pag feel natin na hindi na natin maklaro, we need to go to the ophthalmologist. Next, we have the neurologist. Pag sinabing neuro, it's all about our brain or in our nervous system. So, neurologist, it's all about our brain. Next is a psychiatrist. It's all about our emotions, kung anong mga nafe-feel natin, or our mental disorder. Pag nafe-feel nyong warrior kayo, depressed, or fear, full of fear, so you need to talk to a psychiatrist. Next is the surgeon. Sila yung gumagawa ng mga different surgery. Halimbawa ng pagpapatangos ng ilong, pagpapakinis ng skin, or pagpapalaki ng mata. So, they should be called as the surgeon because they are practicing the surgery. And gerontologists, sila yung mga practitioners na gumagabay or nagiging katuwang ng ating mga elderly or mga aged grandparents. Last two, we have here also the nephrologist. Sila yung pwede nating takbuhan kapag may mga problema sa ating bato or sa ating kidney. And lastly is the podiatrist. Ito yung ating specialist para sa ating paa. Pag halimbawa makati masyado or nagkakaroon ng maraming sugat sa ating paa, you just need to go to the podiatrist. That's all for today, guys. Our activity or your activity will be posted in the Google Classroom. Goodbye, everyone.